mynews.studio.
Picture this. In a London clinic, a nurse fills a syringe. It might seem routine, but today, that shot could be a turning point against one of the world's hardest to treat infections.
Today is August 9th, 2025. The UK is launching the world's first vaccine program focused specifically on gonorrhea. But why is that such a big deal?
Gonorrhea cases have risen around the world, and treating them is getting tricky. The bacteria are evolving, becoming resistant to antibiotics. That raises the concern that we may soon face infections we can't cure with our current medicines. This UK initiative could shift the way we approach the problem.
The vaccine they're using is called 4C-Men-B, or Bexsero. But here's the twist. It was actually created for meningitis B, not for gonorrhea. How did we end up here?
It's quite interesting. Research found that people who got the meningitis B vaccine were about 30 to 40% less likely to get gonorrhea. That wasn't the original goal, but the protection is real.
Those numbers matter. Just to give some context, England reported roughly 85,000 gonorrhea cases in 2023. That's 3 times higher than a decade ago. The projections say this new vaccine program could prevent up to 100,000 cases and save the NHS about £8 million over the next 10 years.
But the vaccine isn't for everyone right away. The NHS is focusing on people at highest risk, mostly gay and bisexual men who've had multiple sexual partners or a bacterial STI in the last year. Why target that group first?
Because that's where most new infections start. By reaching those most likely to catch or spread gonorrhea, the program can have the biggest impact. As more doses become available and we learn more, access can widen.
And there's the practical side. People eligible for the gonorrhea vaccine can also get shots for Mpox, hepatitis A and B, and HPV during the same visit. It's a chance to offer broad sexual health protection all at once.
What about side effects? Is it any different from when the vaccine is used for meningitis?
It's nearly the same. Most people just get a sore arm or a mild fever. Ongoing monitoring will track any rare problems, but so far it lines up with what we saw when using the vaccine for meningitis B.
Other countries are watching closely. So what might slow them down from starting similar programs right now?
A few barriers: getting regulatory approval, finding the money, and organizing logistics. And then there's the challenge of reaching people most at risk. In lower-income countries, it's even harder. Gaps in health systems and resources can delay things. Gonorrhea often hits hardest in places with the weakest infrastructure.
Is there something those countries could take from the UK's approach?
Integration is essential. Offer the vaccine alongside other sexual health services, focus on the right groups, and bundle it with other vaccines. Building trust through community partnerships and clear communication helps too. And using an existing vaccine for a new purpose shows how we can act quickly when needed.
So this could be bigger than gonorrhea. If it works, could it shape how we tackle other infections that resist antibiotics?
Yes, it sets a model. Repurposing vaccines, rolling them out fast, and focusing on prevention before treatment. Others are watching to see if this approach can be used elsewhere.
The UK is leading with this program. But is it the moment where STI prevention and antibiotic resistance take a new direction?
We'll know more within a year. If cases fall and resistance slows, other countries might not wait long to follow. It's a real-time case study for public health innovation.
That wraps us up for today. We've explored how the UK is using a repurposed vaccine for gonorrhea, focusing first on those most at risk, and possibly setting the stage for global change in STI prevention.
There's a lot at stake: antibiotic resistance, rising infections, and health system costs. We'll stay on this story as it develops.
Thanks for listening. This episode was brought to you by mynews.studio. Give it a try for free.